Welcome to this edition of the Impact Voices podcast, where we'll discuss the science, the people, and the network. I'll be your host, Dr. Marianne Mureithi, the Chair, Department of Medical Microbiology and Immunology, and a Senior Researcher at KAVI, Institute of Clinical Research. And today, we'll be taking stock of what we've been doing at KAVI, Institute of Clinical Research, how we've been contributing globally to HIV vaccine research, and global science in general. Joining me in this discussion, it's a pleasure to welcome Professor Walter Jaoko, the Science Director, KAVI Institute of Clinical Research. We'll also be joined by Dr. Terry Muhomah, who is a postdoctoral scientist at KAVI, and also we'll be joined by Muema, Dr. Daniel Muema, who is a senior researcher at KAVI Institute of Clinical Research. It's exciting to start this conversation of KAVI's contribution to HIV prevention research. And with me, we have Professor Walter Jaoko, who again has been a mentor to many, a leader and a leading voice to HIV vaccines and general discoveries when it comes to science. So to Prof. Jaoko, in your own account, what has been KAVI's contribution to global health and vaccine research, and in particular, the work that you're doing currently?
Well, thank you. KAVI, Institute of Clinical Research at University of Nairobi, started about 2 decades ago. And this was at the height of HIV/AIDS being a disaster in the whole world. And so the scientists, body of scientists believed that a vaccine would be the solution to this epidemic. And we started very small with no capacity in terms of scientists, in terms of equipment, and all that has now been put in place. And we have participated in a number of HIV vaccine clinical trials. This has contributed tremendously to the understanding of how HIV vaccines work, what works and what does not work. We have been involved in pediatric vaccine. We have also been involved in Ebola vaccine, and currently we are involved in COVID vaccine. In fact, we are expecting another COVID vaccine trial to begin in a day's time. So what I could say as a contribution of KAVI in the world of science has first of all been in contributing immensely to the understanding of HIV/AIDS immunology and vaccine development. We've also contributed in the development of an Ebola vaccine, which is currently being used globally. And now we are contributing to the development of COVID vaccines. There are more that we can still do, and we're looking forward to better years at KAVI.
Excellent. So maybe you can also highlight some of the ongoing basic science research work that KAVI is at the forefront of doing.
Yeah, so we've been involved in mucosal immunology for HIV vaccine research and development, which we have been involved even in training other research scientists from other sites in Africa in particular. And one of those exciting one for us is a clinical trial that is called G003, and which Dr. Muema here would be able to elaborate on some of the laboratory works that we've been doing.
Thanks, Prof. Jaoko. Thanks, Dr. Marianne. So, yeah, we are currently involved in clinical trial analysis for a clinical trial called G003 clinical trial, and this clinical trial is a follow-up of another clinical trial that happened a few years ago in the USA called G001, and this is one of the next generation vaccine candidates that have been rationally designed using all the information that Prof. Jaoko has mentioned that has been accumulated over time through all the work that has been happening. And this clinical trial is meant to induce special antibodies that we call broadly neutralizing antibodies. And we believe that if we are able to eventually induce these antibodies, we will be able to protect people from acquiring HIV. This is one of the steps towards that end goal of achieving broadly neutralizing antibodies. Thanks, Prof. And thanks, Marianne.
Fantastic. And again, to build on to the capacity at KAVI and the work you're doing, apart from even basic science and HIV clinical trials and other clinical trials, Professor Jaoko has also mentioned mucosal immunology and mucosal work, which you're also championing. And with us, we have Dr. Terry Muhomah, who has also been leading this work, and she can tell us more of where we are at, in particular in HIV and vaccine discovery under mucosal.
Thank you, Dr. Marianne. Through IAVI, we have been able to develop our capacity in being able to understand what are the first events once one acquires HIV, and especially looking at the mucosal surfaces, which are the port of entry when we are looking at HIV. So through IAVI, we've been able to build our capacity. We are grateful for the collaborations through the North and South collaborations, where some of our researchers have been able to be trained through this, and also we've been able to set up the mucosal platforms at KAVI. In addition, we also contributed to the C100 protocol. Our capacity has been built to be able to assess when we're looking at the mucosal surfaces, can we be able to quantify the amount of BNAbs that are reaching these critical sites? So those are some of the capacities we've been able to build at KAVI to be able to do mucosal immunology.
Fantastic, Terry. And again, we look forward to the successes of not just the B-cell, G003, and also the different clinical trials, but also we want to now really focus on the most important aspect of our work, and that is community. We would not be here without the people, without the volunteers, because again, we are a network of people. We are a community that are working together, both scientists, volunteers, and a wider medical community to contribute to this science. And maybe Prof. Jaoko, you can comment on the community-rooted science that we are involved in at KAVI.
Thank you. As you rightly say, all the work we do at KAVI would be impossible without involvement of community. And right from the beginning of KAVI, we set up to ensure that whatever work we do with involvement of community. And in so doing, we established community advisory boards. And these are specific for particular studies. So what would happen is, if you're going to do a study that involves adolescents, for example, then you'd set up a community advisory board that involves adolescents. These are the people who would be able to tell us what to do and what not to do. We also have community advisory boards of men who have sex with men, because some of the studies that we've done have recruited people from that sector of the population. Why do we involve communities? Because without community supporting whatever you are doing, you're a non-starter. We need to involve these people. They're the ones who are going to be involved in the particular collection of samples. They're the ones who will be taking us to the places where we can find particular sectors of communities where we are able to recruit our study participants. Not only that, we have also established what we call peer leaders. These are people who live with these communities. There are some who have participated in our trials before, and they are our ambassadors within the community. They're the ones who, in the event that there is anything that is viewed suspiciously, these are the people who are our voices to tell the people that the science we are doing is credible, it is recognized, it is supported even by the government. So in short, I would like to say, with the support of Community Advisory Board, with the community peer leaders, and then with our own staff, who we call community liaison officers. These are the people who organizes the communities to educate them on a particular study that we're doing. What are the potential side effects, if there are any? What are the expected results in terms of what are we aiming to achieve by conducting these studies? So the three partners, community advisory boards, the peer leaders, and our community liaison officers, have been a tremendous help in helping us recruit study participants. And with the support of community, we also get what we call a good follow-up. All our studies, we have people staying up to the end of the study. Why? Because the communities believe in us.
Fantastic, and what an achievement. And again, we've seen these issues were again highlighted during the COVID pandemic, where people were not trusting the science, not trusting the vaccines, but we involve communities right at the start of these clinical trials, the start of these discoveries. Again, it's like hitting two birds with one stone. Again, the vaccines will be readily accepted and will be able to get ahead of these infections and also upcoming pandemics. So congratulations to the team here, to the team at KAVI, and also the wider team, the communities and the volunteers all over who've been participating. So with all that, Terry, Daniel, Professor Jaoko. What's next? What's next for KAVI? Where are we heading to, and what is the vision for in the next 20, 30 years when it comes to science? Maybe I'll start with the lady. Terry, what's next?
I think for KAVI, we are entering into a very exciting time where we are looking to develop a non-human primate model where we'll be able to contribute to preclinical studies and to be able to understand if we have an immunogen, if we have a vaccine that we want to test on non-human primates. Are we able to do it here in Africa, here in Kenya? And so we are currently developing this platform. We've actually conducted our first study, which is very exciting for us. And we look forward to collaborating with more and more partners who are interested in testing drugs, testing vaccine, as we build our capacity here to be able to contribute in that very key area.
Excellent. I don't know, Daniel, what's next?
I think the future is very exciting. We have several very interesting vaccines that have been designed using a lot of knowledge that has been accumulated, and these vaccines will be entering into clinical trials, and because they are really very promising, we want to be well placed to inform their improvement, their iterative design, and our future. We'll have a lot of analysis for clinical trials, like what we are doing for G003. We expect to do it for many other clinical trials that are coming up that might lead us to a successful HIV vaccine. And then something else that is somehow linked to our community is understanding how our community, the biology of our community. Because many a times we have wondered whether things that are developed in the West, whether they are suitable for our communities here. And that's also actually something that we have already started doing, looking at the biology and seeing whether the biology of our communities can accommodate and benefit from these vaccines, so that they can be tested appropriately, the vaccines, and so that they can be eventually rolled out. So this is something we want to push forward, because we think it is the best thing that we could do for Africa, because the African population has been understudied in the past, and we want to be very well informed as we move into the future.
Okay. So getting the right information, the right data, and I guess, again, I've read of something known as personalized medicine. So if you're making a vaccine for a particular population, what is underlying? So again, that is very exciting work. And to you, Prof. Jaoko, as a leader, what is your vision, particularly in terms of capacity of the next generation of young scientists? Where are we going with that?
Yeah, thanks. In addition to the science that we are aiming to achieve in the coming years, you rightly say we would need to build capacity and even for succession planning. So at KAVI, we have partnered with other partners, and we have collaboration with other partners. And in one of the areas that we are training people. We have a Ph.D. training programs where we are building capacity of future scientists. And we are glad to say that we currently have a D43, which is an NIH-funded program where we're training people at PhD levels. We have 9 PhD students who are looking at very different aspects of science, and these would be the future leaders. We also building capacities in terms of scientific writing, and we have funding from IAVI under the program we dub uandishi, which is a Swahili word for writing. And through this program, we are training people to be able to publish the work that they do, because without publication, science becomes dead. People need to know what you are doing, how you did it, and what you achieved. So through this program, we are able to train future scientists on scientific publication and writing.
Okay, and I'm quite curious about your vision when it comes to also women and women in research, because I think now we're gaining that momentum of having gender balance, equality. When you go to look at SDGs, it's also really features that, again, we are really studying vaccines and medication, or at other trials that will impact in particularly women and young girls. So what is your vision as a lead in KAVI in terms of women and their role in research?
I would actually say that when it comes to women in research, KAVI has done really well. I would say that more than half of our population in KAVI are women. More than half of the scientists are women. And we have an example of Terry here. who is a woman in science, and I would like her to give a bit of her perspective on this issue of women in science.
Thank you, Professor Jaoko. I agree with Professor Jaoko and Marianne that KAVI is really providing a very good environment for female scientists to thrive. They have excellent mentorship programs where we are working very closely with the senior scientists such as Dr. Muema and Dr. Langat, and also just recruiting really the best brains in the country and really globally. And so at the moment there are 3 postdoctoral scientists, and there are more and more women who are being encouraged to take part in science. So yes, KAVI is providing a very conducive environment, and we are grateful.
Excellent, and again just shows or highlights how great a place to work KAVI is. And again, personally myself, I've really grown in KAVI. I've been there for almost 10-15 years, and I've been able to really grow, not just as a scientist but as a thinker, and really taking recognition of what I'm doing in terms of how it impacts not just today but the next generation. So the future is bright at KAVI. And again, just bringing back to all of us to the perspective, maybe Dr. Muema, you can answer this. Where are we in terms of HIV vaccine? I keep being asked even by my relatives, you've been talking about HIV for so long. Why don't we have a cure? COVID came, and within a year or 2 we had a vaccine. Why not HIV?
Yeah, we actually thought we would have had an HIV vaccine by now, maybe even more than 10 years ago. I'm sure when Professor Jaoko, when they were starting their careers, they thought that they were going to get it the following year. HIV proved to be more tricky than many other viruses. It has its own ways of escaping. And we have had to accumulate a lot of information. And I think all those years that have been invested have been very productive. We have understood how the human body works, how many viruses work. And in fact, that's the reason why we got a COVID vaccine very fast. We used systems, we used knowledge that we had acquired, the field had accumulated from HIV research. And that's the reason why the COVID vaccine was developed within a year or so. So I think we have had our own lessons, and I'm sure those who went before us actually have many more lessons, but one of them was that we needed to understand how the virus works and the best way to target it. And that's where these new vaccines are coming in. These vaccines have not been developed the way other vaccines were developed previously for other diseases. They have been developed to target HIV in a special way, so that wherever it tries to escape, the way we target it, we actually target the most vulnerable parts of the virus. And that's what these new generations of vaccines are doing, targeting those parts of the virus that don't change, so that we are able to target the global variation in the virus, because one of the biggest issues is the fact that the HIV virus in one person is different from the one in another person to a big extent compared to other viruses. So that has been the biggest issue. But we have some things that are coming up, these vaccines that we are coming up with, that we are testing now, hold better promise in being able to nail down that virus.
Danielle, that was quite inspirational and actually gives us quite a lot of hope that we live in a generation where we're going to see HIV vaccine being rolled out and being used in communities and populations that need it the most, giving us hope and giving us one step ahead of many other infectious diseases. So I want to thank you, Danielle, Terry, Professor Jaoko, for joining us in this podcast, and look forward to many other exciting conversations. And I also want to really thank the viewers and also the listeners to this podcast, and look forward to joining you again for other discussions and conversations. Thank you.
Thank you for listening to this episode of Impact Voices. We hope you enjoyed it and found it enlightening. Stay tuned for more episodes of the Impact Voices as we explore the vaccine research milestones together. Feel free to share this podcast with your networks and to follow our story on iavi.org/our work/advance.